Leaked documents reveal COVID-19 infection up to 52 times higher than official figures in China's Shandong province. By Tyler Durden. Authored by Nicole via the Epoch Times. The novel coronavirus outbreak in eastern China's Shandong province is much worse than officially reported, according to a series of internal government documents obtained by the Epoch Times. Between February 9th to 23rd, Shandong authorities underreported the number of infections every day, according to internal data compiled by the Shandong Centers for Disease Prevention and Control, CDC. The latter kept a tally of the number of patients who tested positive for the virus during nucleic acid testing, using a diagnostic kit to test body samples and detect whether they contain the virus's genetic sequence. The Shandong CDC daily new infections numbers ranged from being 1.36 times to 52 times greater than the officially published data by the Shandong Health Commission and China's National Health Commission. As of February 25th, the Shandong government stated that there were a total of 755 infections in the province, but the internal documents show that 1,992 people had tested positive for the virus via nucleic acid testing as of February 23rd. The government publicly stated that there were 4 newly diagnosed coronavirus patients on February 22nd, but the internal document said that 61 patients were diagnosed with the virus that day. In recent days, official data shows new infections leveling off. For example, on February 25th, the National Health Commission reported only a total of 9 new diagnosed cases outside the Hubei province, where the outbreak is most severe. In fact, Shandong alone with new infections in the double digits daily. On February 20th, new infections spiked, with 274 testing positive. To date, this is the most definitive evidence that the Chinese authorities routinely underreport cases. Previously, the Epoch Times interviewed staff at funeral homes in the city of Wuhan, the capital of Hubei, who said they had to work around the clock in order to keep up with the dramatic increase in workload. Health experts have also hypothesized that the Chinese official figures are inaccurate, based on their statistical modeling. Recently, a group of American researchers published a study, not yet peer-reviewed, in which they suggest cumulative infections and deaths in China could be subsequently higher than officially stated, by a factor of 5 to 10. U.S.-based commentator Tang Yingwang told the Epoch Times that authorities reporting fewer infections was likely due to a tactic to convince Chinese citizens that the virus spread was contained, and thus it would be safe to return to work. Chinese businesses were shut down for the Lunar New Year holiday, which was extended in order to prevent cross-infection in the workplace. The central government, fearing the economic inactivity could have long-term impact, asked firms to resume operations on February 10th. Beijing, is trying to create an image that most of the country is safe enough to resume production, Tang said. Shandong, the internal data shared with the Epoch Times includes a breakdown of diagnostics results from all 16 prefectural-level municipalities in Shandong province, which were sent in an email to the Disease Control Department of the Shandong Health Commission. The Shandong CDC compiled daily statistical reports about coronavirus diagnosis, tallying positive test results at all hospitals in the province that were qualified to conduct such testing. For example, on February 22nd, Quizhan Hospital in Yente City tested 229 patients. 12 of them were diagnosed with the coronavirus. Quizhan Hospital is a dedicated infectious disease hospital. At times, the Shandong government reported 1 or 2 new diagnoses to the public when the internal data showed much more. On February 22nd, for example, the government reported 2 newly diagnosed cases in the day prior, but the real data was 59. On February 20th, the government reported 2 newly diagnosed cases for February 19th, but the real data was 49. And on February 19th, the government reported 1 newly diagnosed case in the day prior, but the real data was 52. For the period between February 8th and February 22nd, the government announced there were only 347 newly diagnosed cases, but the internal data shows 1,072 new patients, more than 3 times the published figure. Diagnostic kit not sufficient. One Chinese researcher suggested that the diagnostic kits alone would not be able to detect all the virus-infected patients. This disease, coronavirus, has a character which is not all patients can be detected positive when using nucleic acid testing, Wang Chen, director of China's Academy of Medical Science and critical care medicine expert, told state-run broadcaster CCTV on February 5th. Wang explained that although nucleic acid testing is currently the only official test method the Chinese medical staff use to diagnose coronavirus, the result is not accurate. Only 30 to 50% of the patients present positive, according to Wang. He explained that all patients who test positive are infected with the coronavirus, but another 50 to 70% of patients are actually infected but cannot be detected by the nucleic acid testing. Links for this article will be in the description.